How do embryos implant? In the past, we thought embryos force itself into the endometrium, burrow inside, and before developing further. Actually, it's not the case. I'm Teoh, obstetrician, gynecologist, and fertility specialist in Perth. I'm going to show you a video from a research done in Europe and UK, actually quite a while ago. It's published in 2012, 8 years ago. I thought it's interesting to show to the audience in Perth and Australia. I'm going to show you the video now. Ladies and gentlemen, this is the paper I was talking about. Two prominent reproductive medicine and obstetrics researchers I know are in this paper. They are Jen Brosens and also Nick McClone. Let's scroll down to the interesting videos I was talking about. There are two. So let me expand. Now this is the embryo. This is the culture of endometrium the embryo is in. And have a look. When the embryo is in, you can see the endometrium actually growing towards the embryo. So it's not actually burrowing in. It is actually the endometrium embracing the embryos, growing towards and looking after and nurture the embryos. Second video. This is a different view. If you can see, if I click play, same story. You can see and this is the embryo floating around, the endometrium actually going up and trying to embrace the embryo itself. Not the embryo burrowing inside, but the endometrium growing up and embrace the embryo. This is a very important and interesting finding. In the past, we thought the embryo force itself in, burrow itself in the endometrium before implantation. Actually, it's not the case. As you can see, the endometrium actually moves up and embraces the embryo. Now, this is the result of delicate cross-talking, communication, and also orchestration of the whole implantation process. The group also found out that when they put a non-viable embryo into the same culture of endometrium, nothing happens. So if the embryo is not suitable or not alive and not viable, it won't implant at all. Endometrium won't even embrace the embryo. One of the very important research areas of reproductive medicine would be endometrial receptivity. We believe the endometrium can be too picky or it can be too lenient in accepting the embryos. I've got slides here to explain a little bit more what do I mean. So you can see there's a line there. If your endometrium is too picky, it'll be on the left side in the screen. And if it's too lenient, it will be on the right side. What would be the result of this? If the endometrium is too picky, that means no embryo can implant. You can have a perfect normal embryos trying to implant, but the endometrium just don't accept it because it's just being on the too picky side. On the other end, you have the endometrium which is too lenient, where there are too many bad embryos, abnormal genetics, abnormal formation and such. They are not meant to implant. But in this instance, all embryos, almost all implant. You may hear stories that some patients would tell you, look, I got pregnant within the first month of trying, but I always have miscarriage. So this could be the case. The embryo just take on any embryos trying to stick on, even though they are abnormal. They won't progress to a normal, healthy baby. They implant anyhow, towards later on ended in miscarriage. What we want is, if this theory is true and applicable to everyone, to some patients, what we want is a well-balanced endometrium where they're not too picky. They know, look, if the embryo is good enough, they take on the embryos. If the embryo is abnormal, they don't accept it, preventing a miscarriage later on in pregnancies. So this will result is only healthy embryos implant, and we have a good going, continuing healthy pregnancy. Most cases of fertility problems and also miscarriage, they are multifactorial, so we have to consider other things as well in the workup of the reasons. But this endometrial receptivity causing either miscarriage or subfertility should be one of the things that fertility specialists think about when making a plan for patients to help them to have a healthy baby soon enough. That's it for me this time. Goodbye.